Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today to have a discussion is, of course, Dr. Ricky Johnston from Gastroenterology Associates. How are you, my friend?
Doing well, Troy. How about you?
We are fantastic. As everyone can see at home, we're in our homes doing this interview. And before we get into our questions, I wanted to ask you, how are you dealing with everything and your family at this time?
We're dealing, I think, was with everybody else. They're finding that there's some struggles and also some rewards. You know, having the kids at home without school or family help or babysitters has been challenging, particularly for my wife. God bless her. She's doing God's work. But it's been challenging, but it's also been, rewarding. Being able to work from home. I've gotten to spend more time with my kids during the day, particularly our 8-month-old. So while there's challenges, there's definitely rewards. And, we're just trying to make the best of the situation.
Of course. Now, look, what do you think of the COVID-19 situation and what effects do you think it's having on your patient's digestive health?
Fortunately, I don't think it's having any long-term effects on people's digestive health. Now, there are a few GI symptoms that people may develop to go along with the other typically, seen symptoms. There's nausea, vomiting, diarrhea, potentially abdominal pain. So really non-specific symptoms that may accompany the other ones. There's also the loss of taste and smell that are really commonly reported. But I think more importantly is to focus on shortness of breath, fever, cough, and maybe the smell and loss of taste rather than, focusing on GI symptoms as a presenting issue. While those may be there, it's probably, 10 or 20, 30% of affected patients who develop that.
One thing you and I always talk about when we do these interviews is screenings and colonoscopies and how important it is. What are you saying to everyone now that if they're putting off their colonoscopies, and should they be coming in for some form of screening, and is that possible?
Well, we've been directed by the state for the time being not to perform any elective procedures. So thankfully, the regulations on telemedicine have gotten relief. So I've been spending a lot of time in my chair doing telemedicine visits. And so what we're doing is we're seeing patients via setting up screening, but we're scheduling those out 4 to 6 weeks, hoping that by that time we're going to be, able to go full. Certainly, we don't want to put off screening any longer than we have to. Right before the pandemic hit, we found 3 or 4 cancers in a week. And so certainly by not doing our procedures, we're missing the opportunity to diagnose some of these cancers at an early stage. So there is some angst with that, but in general, we're having to push out the screening test for right now. Now, if anybody's having symptoms, if there's any kind of diarrhea, nausea, vomiting, rectal bleeding, anything that's severe symptoms, uncontrolled GERD, just trouble swallowing, things that are particularly bothersome, then they should go ahead and call the office and we can see them via telemedicine. And then at that time, we can make a decision. Is this urgent? Does it need to be done now? Because we can do urgent, procedures. Or is this something that's less urgent and maybe we can wait a month or two? But the best way to know is to call. So don't be scared to call. We're still up and running and seeing patients.
Wonderful. I'm glad you said that, but I also want you to put everyone's mind at ease.
Yes.
How safe is it for them to be coming in to have their screening, and what are you doing about that?
We are taking every precaution that we can. We are allowing only the patients to come into the building, whereas they used to be accompanied by a family member. We're screening our employees and patients before they come in with a list of questions about exposure, fever, et cetera. We're checking temperatures. All of our staff are wearing masks during the procedures. We're being very diligent about hand washing. We're allowing the patients will wear their masks until the time of their procedure. If we're doing an upper endoscopy, we have to remove it for that. But we're taking all the necessary precautions, and I think we'll make sure that everyone's safe.
Well, Dr. Ricky, you always give great information. I want you and your family to stay well. And I know all our viewers at home also appreciate the information that you give. We appreciate you. If you want to find out more information about Dr. Ricky Johnston, there it all is up on the screen for you. Gastroenterology Associates of Columbus. If you have any thoughts or concerns, give them a call. They will help you talk your way through it. Back after this break.